I'm here to introduce Michael Levy. Michael Levy is a passionate healthcare executive with more than 10 years of operational experience in the healthcare field. He's the entrepreneur in residence at UNC's Healthcare Center for Health Innovation and the co-founder of Blue Door, a digital health agency that connects people, catalyzes innovation, and commercializes solutions through an innovative collaborative framework. Prior to Blue Door, Michael was co-founder and COO of Digital Therapy, a cognitive computing platform powered by IBM Watson in the behavioral health space. He was the vice chair of administration for the Department of Medicine at the University of Miami Health System, engineering a $15 million turnaround. He led clinical operations for UNC Healthcare's specialty ambulatory clinics, and prior to his role at UNC, Michael held several leadership roles at UCLA Health. He has a BSc in neuroscience from Tulane University in New Orleans and an MBA from Elon University in North Carolina. Thanks, Michael.
All right. Can we hear me? Everyone here? Wonderful. Well, thanks so much, Erica and John. First off, amazing to have this event take place and the kind of continuation of events in this triangle around digital health. John and Erica, Smashing Boxes, Duke Digital Health, is anchor leaders in this space and in the triangle, and we work closely day in and day out to make sure that the digital health subject matter in the triangle is front and center and part of our day in and day out focus as we move forward into the future. John and Erica asked me to speak to is your solution viable? And this was met with some excitement, but also, boy, if I had a crystal ball to suggest the viability of solution, I would be in the Bahamas somewhere off the coast on my yacht sipping Mai Tais with my wife, and perhaps doing this from there. So I thought perhaps to start anchoring us in the perspectives, and Drew did a great job of alluding to it, the provider organization, the provider perspective, the entrepreneurial organization, or the entrepreneur perspective. This assumes, of course, you're not taking a solution direct to the consumer market. That's a whole other equation and roadmap. This assumes we're building a digital health solution that is working its way into clinical delivery. If you're ever part of a provider organization as an administrator or a provider, nurse, caregiver, et cetera, and you want to build or adopt digital health, it's a frustrating road. It's a very frustrating road to navigate a health system's prioritization, right, of margin, technology. Generally, the IT departments in health systems and AMCs are focused on enterprise applications, generally operationally focused, right? And the risk tolerance is very low in provider organizations, et cetera, et cetera. And on the flip side, entrepreneurs, we have a tough roadmap too to build a digital health technology, to test and validate it, to gain access to clinical workspace and patients and providers to validate our products. Just a quick fact, 98%, Dave Chase, a leader in this field, said back in January of 2016, 98% of digital health startups that receive angel funding don't make it to Series A funding. That means 2% success rate to go from angel to Series A. And that just speaks to the challenge as an entrepreneur to be successful and viable in this space. Like Drew alluded to, and we'll talk about a little bit more, technology really isn't the issue here. It's about the innovation around the model itself and the components that make up that model. Integration, absolutely. Integration and innovation. I love it, Drew. I think we'll start to talk about here some principles perhaps that you can take home and back to your day in and day out as you think about digital health and the ideas and solutions, whether you sit inside the institution and the provider organization or outside as an entrepreneur. What does some critical questions that you can pose throughout this journey to ensure that you're optimizing the chance you have for success and ultimately to find that viability. we look at this innovation roadmap as kind of our anchor and our honesty machine to a process that we follow, going from problem sourcing all the way to impact and commercialization. We like to think of it linearly because it keeps us true to starting in the need and working its way out. But in actuality, this is more of a cyclical paradigm. As you all know, iterating, testing, validating, bring it back in and doing it all over again as quickly and efficiently as possible is the name of the game to reduce risk and increase your opportunity or chances for success. What's critical here is the evaluation criteria that we look at. 2 points. One, that we test at every stage and throughout the process. What's the need? Who are the people on the bus to drive execution? What's the technology I need to enable? And does it impact across the quadruple aim, right? Do we provide higher quality care at lower cost with greater experience when we want it? We call that the E4, and I'll get into that in a little bit. Specifically, the need. And it seems somewhat, I would say, almost simple to suggest that that's a focus of building a solution, because inherent to the solution itself, fundamentally, there needs to be a need. But so often, both in my entrepreneur in residence hat at UNC, as well as the Blue Door hat as co-founder and CEO of Blue Door, I have pitches and ideas come to the table to be talked about, whether asking questions about its viability like this, or seeking support, partnership, etc. They frame the market beautifully. They talk about the technology and the functions and the features, and they really lose sight of the exact need, the pain points. You know, Drew did a great job of presenting two personas, 2 points of views, talked about specifically the need, the exact moments where their lives could be bettered and improved by technology, not for technology's sake, but for the end user's sake. And so when you think about the need, you really got to anchor it down into what is the pure intent of the solution to enable what improvement in an end user's life, right? Again, so often this is missed. And what ends up happening is you get a situation where you have over 350,000 applications on the App Store for health-related, where 50 applications account for 50% of the actual usage, right? And we'll get into that a little bit in the technology portion. As it relates to people, this is about who's on the bus. And I've had the pleasure, as well as the misfortune, but a learning experience along the way, to know that ideas and products can fail based off of who's on the bus, but even worse, they can fail because of who's driving the bus, right? I've had a personal situation in a venture I was part of, where we had an absolutely slam dunk first product, MVP. We had this craving module that potentially could be rolled out and leveraged milestone to milestone from there. But we showed early indication that 95% of the time someone took this module, they curbed the craving, right? So our projected product roadmap and launch strategy was to get it out, first MVP out in 4 months for about $250,000, and to get first traction in respects to that data point of cravings. Well, we went into a 1.5-year product cycle, building a program outside of customer discovery and true alignment to kind of first point need, and we ran out of money. Essentially, the product is sitting on a shelf because we reached the valley of death. We couldn't get access to the various environments to test validate this program versus this module. And so what was a very good problem, identified need, a technology that we knew could provide a solution to enable an outcome, it was the person and the people that inhibited the viability in this equation, right? And so you got to make sure organizational culture is absolutely critical to ensure that you're moving down the road attached and aligned to the need and the problem. fill the competencies around that equation, inclusive of the organizational culture. So answering questions like this get to those fundamentals, right? Moving on to technology, we get in this situation where we build technology for technology's sake these days, it seems, right? Because in large part, this API kind of emergence and the, I would say many additional components to this equation, but just for simplicity purposes, because of the emergence of APIs, technologies has somewhat been democratized in a lot of respects, where we're able to do things that we would otherwise need tremendous amount of resources to do by way of pulling in an API from here, 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 and here to create a solution. We don't actually create the APIs or the functionality, but we just create the integration, right? And so that leads us to building things perhaps in a vacuum, and we do this. And so when you think about your technology, and this plays into the rest of this conference today, where we talk about usability and feasibility, and you'll get some depth in there in future talks throughout the day. But these are the questions that you've got to ask, and you've got to have confidence in answering, and they're not all applicable to every product. Right? Interoperability doesn't necessarily have to be front and center, but you have to ask the question and be confident that that isn't part of the roadmap, right? But if it is part of the roadmap, you got to have a strategy around it. Ensure it's addressed, because if you don't, it's going to come back and bite you. And the success or viability of a product will inevitably be inhibited because of it, right? So this leads us to, once you have, your need isolated, your problem well-defined, right? You've hired and onboarded or recruited the best talent, whether it's employees, contractors, or partner to execute. You've built a roadmap for technology that gets you milestone to milestone in an efficient and effective manner. You're ready to go. The next thing you got to worry about is showing outcomes, right? Showing proof, showing data. You got to make sure, getting back to the quadruple aim, that your solution touches one of those pillars, whether it's cost, quality, experience, right? Or affordability, you name it. It's about these four components and gaining traction across each of these pillars. Now, if you can get one, go deep, and then move over to the others. We've seen successful solutions attack all, one, some, etc. But nonetheless, this is a game about leveraging data points, milestone after milestone, and proving that you're not only delivering high quality care at a lower cost, but you're delivering a higher experience, and you're engaging us. And this talks at Drew's presentation talked tremendously, right? Because we could build something, but if it's not being used, there is no value, right? So that's why I can't wait. I've just learned something I can take on. Integration and innovation is invincibility. I don't know if my 2.5-year-olds will quite get it the way we do today, but I love it. So in summary, need, people, technology, E4. If you have the passion, right, and you have the team, or you have knowledge of who you need to bring on the team because you've done the extensive customer discovery process, the research to understand who your users are, what the need is, what your proposed solution is, and how that impacts them. You put together that team that's going to go the distance with you, that's going to fight these battles, these kind of very barrier-ridden path to success, right? It's doable, but it's a tough journey. It's real. You got to be mindful of these kind of minefields of these questions that we've listed here and these kind of organized evaluation criteria set. Once you have the technology in place, and you're starting to show movement in the E4, these are signs of viability. These are signs of viability. So it's a very tough question to answer. Is your solution viable? I think if you walk away today and remembering these 4 points, and then some of the questions that underpin these points, you'll understand that really, healthcare is a people business in need of technology solutions, not a technology business in need of people, right? The days of build it and they will come are over in healthcare. Consumerization and choice are here to stay in an increasing and exponential way. As consumers engage in the technology that is here and doing all the things that we want and can do, we expect that from the healthcare system now. And we're going to increasingly do so. And our payment paradigms are going to do so, align so as we mature in this pay-for-performance paradigm shift. So again, we are in a people business here. Healthcare is about the relationship. It's about the integration, like Drew said, not just of the technology, but of the partners and the people to bring that technology to fruition. So thank you very much. Is your solution viable? It's a great question. We should all think about it every single day. Pleasure.